Good morning, everyone. This is Heiko from the Acupuncture on Air show of Radio Kidnappers, where each Tuesday at 11 a.m. we interview amazing practitioners from around the country. And today, again, we've got Kane from Hamilton. How are you, Kane?
Hey, I'm good, thanks. How are you over there?
No, that's all is good here. Now, thanks for coming back on the show. It's much appreciated because I know we get a lot of interest with acupuncture and women's problems, and in particular now there's a little bit of, how will we say, positive advertising out there about acupuncture because the government has finally decided to register us after 30 years or 40 years of asking them to do it. They finally come through with the goods. So let's just go on and we get right into the show. So tell us a bit, because you do some shows around it where you promote your clinic, but you're promoting, is it the Sunshine External Herbal Medicine range?
Yeah, I've been in practice now for over 14 years, and it's just a good way to get it out there and to get people aware of who you are. As I do a lot of promotions with trade shows, and I run different range of small nights in the clinic, or foot soak nights and things like that, just to educate people on acupuncture and what else is actually out there.
Fantastic,
that you can use.
Yeah. Now, I understand, of course, that in the Hamilton area that you get quite a lot of referrals from the midwives. That again brings me to today's topic of a very common symptom that of course we get during pregnancy, and that is morning sickness. I presume you are seeing a lot of morning sickness, or have a regular.
Yep. And that's the thing too, is a lot of the midwives are referring me clients in the first trimester for morning sickness, and I can pretty much say that a lot of my clients, is 50 to 65, 70% are all of pregnancy. So yeah, the big thing is that they like to see what acupuncture, that they know that acupuncture can help with the morning sickness for some people. So yeah, it's great.
Because I know that many people have an idea or the concept, that acupuncture treats the nerves, and because it treats the nerves, it treats pain, and a bit sort of like instead of taking a painkiller, you stick a needle in a nerve. But then it gets a bit hard for them to understand. Well, morning sickness when you're pregnant, how does it treat that? But could you tell us a little bit, sort of in simplified layman's terms, some of the diagnosis or the patterns that are associated to help us understand how the diagnosis works with Chinese medicine and morning sickness?
No problems. So Chinese medicine, the nausea is said to be caused by what we would call as rebellious qi, or energy flowing in the opposite direction to normal. So which this refers to as this sort of interferes with the descending action of the stomach, leading to nausea and vomiting. So in Chinese medicine, we define morning sickness as rebellious qi, as we said, but there's also a lot of different underlying patterns that we can have as well. So we could have blood deficiency, we could have stomach qi deficiency, we could have stomach heat, stomach deficiency of cold, phlegm accumulation, or even stagnant liver qi invading the stomach and spleen. It just depends on how that person presents at that time.
Right, yeah, because I know in my practice I seem to have a common one, which is what we would call stomach heat. And so it sort of works against the women because that problem in itself makes them feel hungry, and then when they eat, then they get sick, And what do you find? Can you comment a bit on that?
Yeah, yes, depending on what they eat. If they have a hot stomach condition, then having warm or hot foods or greasy foods, then this could actually make it worse. Rather than if someone had a cold condition, then something like ginger would make it better.
Yeah. And one other scenario that I have with like quite a number of morning sickness patients I've had is that dampness. That's sort of the traditional Chinese concept of dampness is there's too much humidity or too much water, blocking in the system. And And this one's a hard one to explain to patients because everybody else is telling the mum, drink more water, and then we come along and say, well, actually, don't drink more water because you're just adding more water to a wet sponge, you know. And I recommend in these cases that they should just like sip a little bit of hot water. What's your take on that one?
Yep, exactly that, Heiko. It's exactly that. It's like adding more water to a wet sponge, which makes them feel more full, or it makes it more full and more soggy. So therefore, if you are drinking a lot of water, then that would make the condition even worse. So, like you say, just sipping the water, small amounts is better in this case, rather than big large amounts. And even warming water, not too cold water as well.
Yeah.
That would be another good thing that you could do. It's room temperature or just lukewarm water.
Now, what about any points you can sort of tell us off the top of your head?
So I would do points for me. I would do inside points that would help the stomach and spleen as well. So Yangling Chuan is a good point for this as well. But the points to help build that back up or help clear the dampness out of that system. It's very, very effective as well. So it sort of almost like dries the dampness up or dries the phlegm up in the area.
Now, I know that before you mentioned ginger, so just tell us a little about, everyone's rushing out and having ginger when they have morning sickness. Can you give us, shred a bit of your light on that?
Yeah, so the depending on the underlying condition, obviously, specific things that we could do is that if it's from a cold condition, then again it's that ginger that warms that system back up as well. So therefore it sort of almost dries that out as well. And it's but if we had ginger for a hot condition, then it would tend to make things a lot worse as well.
Yeah. That's good. We'll make a herbalist out of you yet, Kane. You know, with that amazing understanding there you've got through. Now, because there's still the endless row of skeptics and non-believers out there, and the question they ask, is there any research on acupuncture morning sickness? Do you are aware of any off the top of your head, or do you know anything about it, or books we could maybe go to, or?
Yeah, I mean, the research for this at the moment, I'm not too sure, or don't quote me on any of these, but we're starting to see a lot of all this coming through now, and I think this is why a lot of people are sort of trying these things out there, because of that we are getting lots of good results, especially I know in my clinic, and I know in a lot of other clinics like yourself. We are getting great results with clients like this, So at this stage, I think with the word of mouth and with the success of them telling their friends and the midwives telling them as well, it's
you don't need to confirm anything with research. Yeah. Now, just before we go, I mean, of course, one of the questions people always are, how many sessions, how long does it take? And I know with my own clinic, because I tend to be a little bit booked ahead, like a week or two, sometimes for 3 weeks. And so, the morning sickness suddenly hits and it's difficult for them to get in. But what about with you? I mean, are you suggesting once a week or more often, or what's been your experience there?
What I'm finding is that for myself with morning sickness is that 1 or 2 treatments will help a great deal. I will say to them, if I can at least even get 50% better, they're going to feel a whole lot better within themselves as well. So monitoring that, if they're not feeling any better, then we can give them points like, pericardium 6 on the inside of the wrist to massage that. That helps address the stomach condition as well. And also we can give them ear seeds. Sometimes I put ear seeds in their ears and they last for 3 days without causing any harm or problems, and they're fantastic. And clients love them too.
Fantastic. But I think we better finish up because Jill, our amazing manager over there, she's looking at the console and looking at the clock. She's starting to get stressed because I think she's got another interview at 1 o'clock or something. So we'd better finish up here. But thanks again for being on the show, and just give us your your best phone number for people if they want to give you a call and have a chat to you about
Yes,
anything
no problem.
related to pregnancy and morning sickness?
Yeah, no problem. So 027 4999 831, and I'm at Connect Therapies in Hamilton.
And we'll see you on the next show. Thank you, Kane.
No problem. Thanks very much.
Okay, bye.